Good morning and good afternoon, everyone. I hope you can all hear me well. I can see we still have some attendees coming in, so I'll give you all another second to just join in and then we'll get started. Okay, I'll get started. Thanks everyone for joining us and welcome. Good morning, good afternoon, good evening, wherever you are in the world. This is the fourth webinar of the series on social protection in South Asia, looking at the landscapes before COVID-19 and a snapshot into the response to the crisis and the paths ahead. This was jointly organized by IPCIG and the UNICEF Regional Office for South Asia, ROSA, and also the various UNICEF country offices in this region. Today's webinar will be profiles of the social protection systems in Nepal, Sri Lanka, and Afghanistan, both prior to COVID-19, and snapshots of their response to the pandemic. This webinar was a collaboration between IPCIG with the UNICEF Regional Office and UNICEF country offices of Afghanistan, Nepal, and Sri Lanka. So today we'll be focusing on Sri Lanka, Afghanistan, and Nepal, but the next webinars in the same series to take place on September 24th will be on Bangladesh, India, and Pakistan in the same format, and then again on October 22nd for Bhutan and the Maldives. And links for these upcoming webinars will be published in the chat by the socialprotection.org team. And then for today, since 2019, the IPC team and UNICEF team in the regional office and country offices have worked together on various studies undertaking a comparative overview of the social protection systems in South Asia region. And this webinar series was created to present these findings to you all. And these 6 studies that our webinar series was based on will appear on the screen right now. Yes, there we go. So there's 6 studies. These were started in 2019 of these different topics. The links on previous webinars during which this was discussed will be shared in the chat box by the socialprotection.org team. So most of these studies started in 2019, looking at the legislative frameworks in South Asia from a child rights perspective, for example, but also looking at non-contributory social protection programs in South Asia through an equity lens. And then later on in 2020, this year, in these studies, we specifically looked at the socioeconomic impacts of COVID-19 and the policy responses in the missing middle in South Asia. So do have a look at these links that will be shared on previous studies and webinars, and the full studies will be shared as well in the coming months. And then another quick update for you on the next webinars for socialprotection.org. There will be a webinar on the 25th of August, focusing on social protection response to COVID-19 and the challenges and opportunities to urban settings in sub-Saharan Africa, so different region. And then on the 27th of August, 2 days later, there will be a webinar about the gendered impacts of COVID-19 in rural areas. And you can find the links for these webinars in the chat box as well. So please do make sure you join those, which will be very interesting. Good, then now I have the honor to present to you as the moderator, the panel of today, which I am very excited about. So my name is Nienke Voppen. I work with UNICEF in Afghanistan as the cash-based assistance and social protection specialist, working specifically on developing child-sensitive cash and emergencies modalities, and also working with the government on developing social protection policies for Afghanistan. And today on the panel, we have an excellent team, all-female panel, which I am very happy about. we'll start with Usha. Usha is the Chief Social Policy of UNICEF in Nepal, has a lot of experience and has been awarded by the government of Cambodia for her work in social protection in the ASEAN region, and has even authored a book, Social Protection: Lens of Blossoming Hope. So do look that up and give it a read. I won't read her full bio, but please do read it on the screen. Then we have Isabella. Isabella is a researcher at the IPCIG, working mostly on Nepal and Sri Lanka, and will be presenting on Sri Lanka to you today. So please also welcome Isabella and read her full bio on the screen. Then we have Louise. She is the Chief Social Policy at UNICEF in Sri Lanka, working on public finance for children and social protection, has been with UNICEF in various different country offices, and will be giving you a presentation on Sri Lanka today as well, together with Isabella. And then our final panel member is Beatrice. Beatrice specializes in social protection and is interested specifically in the links between gender, health, and social protection, and is currently also supporting the process of establishing social protection policies in Afghanistan. And Beatrice is also a researcher at the IPCIG. So this is our panel for today, and I hope you agree with me that it's a very strong panel, and look forward to hearing their presentations. Just to give you a quick overview of how we'll be doing the webinar today. Differently from other webinars in this series, which focus mostly on comparative analysis for the region, this webinar will draw lessons learned from the comparative studies, so those 6 studies that we listed earlier, which will allow us for a more in-depth country-specific analysis, which our various speakers will be to you. We'll start with Usha, who will be summarizing the key takeaways from the IPC studies for Nepal, and will complement it with her own insights from working in Nepal for UNICEF. After that, Isabella will deliver the main takeaways of the IPC study that are relevant to understanding the social protection system in Sri Lanka. And then Louise will complement that with insights from her work in Sri Lanka for UNICEF, and also look at the ways ahead and new goals to be pursued by the social protection sector in Sri Lanka. After that, we will have Beatrice present the key takeaways from the IPC studies in Afghanistan, contextualizing the social protection system in Afghanistan. So all of these presentations will take approximately 10 to 15 minutes. And after that, I will be mediating a 20 to 25-minute Q&A session in which hopefully you can all ask your questions to the panel. So questions are very important. We want it to be interactive and interesting to everyone. So we encourage the audience to send the questions to the panelists through the Q&A box you can see at the bottom of your screen. Please use the Q&A box for questions for the panelists and use the chat for anything else. So if you have problems with your sound or anything, you can use the chat for that, but use the Q&A for questions for our panel. We will try our best to address all the questions during the Q&A. However, if we run out of time or if there's just too many questions, we will prepare a Q&A written document to be shared with the audience and also published with the webinar summary, and which will be available on socialprotection.org. Also, I would request you for your questions to please indicate if there is someone in specific you would like to address the question to, or whether it's a question to the whole panel, and I will facilitate it then. That's all from me for now. I will hand over to Usha now for her presentation on Nepal.
Thank you so much. Thank you so much, Nenke, and thanks to all those who have tuned in. Without further ado, let me take you to my presentation, and I'll start that by sharing my screen. Let me try and get into the presentation mode and minimize the chat box. Can you see my screen now?
Yes, we can.
Okay, wonderful. So this is about Nepal. So before we go into the snapshot of COVID, let's look at the context. So in terms of the legal framework, Nepal is doing really well. 7 out of the 9 most important international conventions on human rights have been adopted, and there's a commitment from the government, obviously, to adhere to them. The 2 conventions which Nepal government still hasn't signed up to, and which are kind of pretty relevant to this context, is the one on the International Convention on the Protection of the Rights of the Workers and Migrants, and the other is on the forced detention. So hopefully we can get there in coming years. Now, in 2016, the CRC committee recommended revising Act Relating to Children, which is, you would know, it belongs to 1992, to tackle the fragmentation of the various child-related legislations in the country. And hence, Nepal came up with a much more comprehensive legislation, which is called Child Act in 2018, which ensured that some of these duplications and fragmentations were addressed. So the SP legal framework, pretty rich for Nepal. And again, social protection is very well enshrined in the constitution of Nepal. In fact, in 2015, the new constitution that Nepal devised in the wake of the peace dividend, after all the kind of, there was some amount of stability in the country, that enshrines the right to social protection, and it enshrines along the lines of vulnerability, whether it is age specific or socioeconomic status specific. And it's also ensuring that it reflects the new government structure. So Nepal has become a federal structure. It went, and it is still undergoing a kind of shifting of the capacity and responsibility from the federal to the subnational governments. But the social protection landscape already has started reflecting that change in the role and responsibility very well. So that's in a nutshell what the legal framework looks like. Now, when we talk about the expenditures in social sectors, and here we are looking at health, education, and obviously social assistance, we see there's a kind of a steady increase in the proportion of GDP which has been going into Nepal. But an examination of public expenditure review reports, which are put forward typically by World Bank, and also now increasingly from UNICEF through the Public Finance for Children lens, show that there is still some scope for efficiency gains. So the investments can be indeed made more effective and more efficient, but overall there is an increase. As you can see in this diagram, in this graph, for the entire region, Nepal is the 3rd best performer. So well done, Nepal, for a small country in the context of being landlocked and still a least income, the lowest income country. There is still a large flow of ODA, but obviously during this COVID context, we did not see as much of it as we would have expected it, because the donor countries themselves are struggling with the financial impact of COVID-19. So what does the social protection landscape of Nepal look like? And here we have looked at 10 flagship non-contributory programs, because as you would know, social protection would largely consist of contributory and non-contributory programs. But this study, which IPCG has undertaken, has looked at the non-contributory 10 flagship programs. Among them, they cover something like 15% of the population. And the important features of this landscape is that these programs are universal. These programs are inclusive. So there is categorical targeting. So for example, above certain age or certain demographics, for example, endangered ethnic minorities or children of certain caste. So there is a categorical targeting, but there's no means tested targeting. So there's no poverty targeting. So the universal approach has worked out very well for Nepal, because it has kind of, gone ahead and contributed to the peace dividend and the social cohesion aspect, which we generally read about as a role for social protection. Now, most programs, as I said, are universal in nature, and there is also increasingly what we see is that the provincial or the state governments has started implementing their own programs. So a state 2 or the province 2, and for example, the province 6 or state 6, they have their own girl child specific social protection programs, and that I think a subsequent study should be looking into that. But there is a good decentralization and happening across social protection landscape. So these are just some examples of, what are these types of programs, what are the targeting mechanisms, which are the groups being targeted, and one can get into it. These are details that one can start getting into if there are questions. So how gender and child sensitive are these programs? So this slide is all about that. So in fact, Nepal Social Protection Program or portfolio is doing very well in being child sensitive and also to a certain extent gender sensitive. We can see that many of these programs out of the 10 flagship that we have talked about have a child dimension and a gender dimension. This table looks fairly busy, if not exactly chock-a-blocked. Many of these programs have been evaluated, so there is kind of an okay culture of evaluation of the social protection programs. It's not perfect, more needs to be done. But as we can see, there are some programs which have been evaluated, especially the Child Grant Program, the Scholarship Program, the AMMA program, or the Conditional Cash Transfer Program for the ANC and the PNC visits. And they seem to be showing some very encouraging results. And I'll dwell a little bit on the Child Grants Program because obviously we are UNICEF, but also because out of all the programs that Nepal has, Child Grant has consistently been proving itself to be the most pro-poor program and also the most cost-effective program. So the Child Grant typically consists of a transfer of about $4 to a child per month to a maximum of 2 children per family, and these children have to be under the age of 5. And in an impact evaluation which was done last year and the beginning of this year, we see fantastic results for nutrition and for gender dimension. Just with even that amount of transfer, women have gained in agency and in decision making, and they have become more mobile and they can say no to several things. And another interesting dimension has also been on the quality time that fathers are now able to have with their children. So these are some of the findings. We also see that there is a program called Karnali Employment Guarantee Program. Karnali is a kind of a state or a region in northwestern part of Nepal. Is generally combating, distressful impacts of droughts. And this is an ongoing disaster mitigation and social protection program called Karnali Employment Program. And that program has very good participation of women, not only because it targets women specifically, but also because they are creche facilities. So other programs across the region maybe can borrow a thing or two from the leaf of Karnali Employment Guarantee Program. So just in terms of how these programs are doing along the dimensions of the human rights-based approach, we see that there is some work to be done, especially in the dimensions which are related to provision of mechanisms to ensure transparency and access to information, or we see articulating long-term financial requirements, or ensuring even predictability of benefits. So in a nutshell, it captures the challenges of implementation that Nepal's social protection programs face. Now, some programs do better than the others. So typically an old age pension program, or sometimes even a child grant program, depending upon where it is being implemented, seems to be doing better in some of these dimensions because these are older, there's more buy-in, there's obviously a more political weight behind these programs because of the demographic involved, and so on and so forth. But in a nutshell, what the slide tells us is that there is still some way to go in terms of getting the mechanisms which articulate well the human rights principles more effectively improved across all these 10 flagship programs that we are looking at. So let's talk about COVID now. So in terms of COVID, I don't know what you see across your countries, but for Nepal, the economic impact of COVID has been pretty staggering. And UNICEF has been carrying out these monthly 7,000 sample size household monitoring of the impact of COVID on families and children, what we called as Child and Family Tracker. And so far we have had 2 rounds. The first round was carried out in May, the second round was carried out early July, and we see a staggering shifting of poverty. The entire poverty line has shifted to the left. 35% of the households reported in July that they had earned nothing. So there's a deepening of poverty, and there's also a more expansion of poverty, which basically underlines the importance of an adequate social protection response. So what's happening with social protection? Again, these are July findings. So if we went beyond the 10 programs that I talked earlier, and I had mentioned that 15% of the population has some sort of coverage, and we looked at, one-off relief as Nepal implemented in the wake of COVID, then we see that 21% of the respondents reported accessing some sort of social protection or social safety net relief. So that's the figure, but obviously it's not adequate, because you saw in the earlier slide, 35% of the families did not earn anything, right? And there was one good news which came out of the July round, is that while May round indicated that many of the beneficiaries of the traditional social protection programs had indicated a difficulty in accessing their benefits because of the lockdown and confusion, and what's going to happen, what is the eligibility. But in July, this seems to be all streamlined, and only 2% of the beneficiaries indicated any problems in accessing the benefits. So something that Nepal did was right, and I think Nepal deserves credit for that. But having said that, we see certain issues for concern. And this is all the more concerning because Nepal is actually a leader when it comes to shock responsive social protection, right? Use of the developmental regular social protection programs to deliver relief to the existing vulnerable populations and the new vulnerable populations as speedily, most effectively and efficiently. That's what Nepal did, for example, in 2015. But we didn't see that kind of enthusiasm in the government for giving cash out or for giving relief out through the traditional system. And especially there was a strong reservation for cash. And this really needs to be understood in the context of the supply shock that Nepal faced, because it's kind of, it really relies very heavily on China and India for the supply of essential items. So that reservation to cash still continues, and which also meant that it was not able to leverage its pretty fairly good coverage of the developmental social protection programs that it has. So most of its relief was about handout of food ration, and this was done in a targeted fashion. The good thing was that the palikas, or the subnational governments, which have become pretty empowered in the new federal context of Nepal, were able to prioritize those who were daily wage earners, the families which had higher dependency ratio, for example, women with lactating and pregnant women with younger children, or a family which had a person with disability. So those were the good things of that planned response. But obviously, again, it remained confined. There were about 1.7 million households which were selected through this kind of selection at the subnational level. So now we have a pre-identified list of the new plus the old vulnerables. And so if the government wanted to reach out again to these families with a new round of food or cash, then probably it would be much faster. They also have agreed to scale up the Cash for Work program. So while they have reservation for cash, they're much more comfortable with Cash for Work program. And implementation for Cash for program, again, has huge number of challenges of its own, right? Especially when it is the issue of social distancing, or those who cannot work, or how quickly you can design the projects and actually ensure that those who really need the assistance can get that in a timely fashion. So these are some of the kind of the strengths and limitations of the social protection response in Nepal. And building on that, we have come up with a set of policy recommendations, which is all listed over here. But obviously, the key among them being, obviously improve the shock responsiveness of the social protection system, the regular social protection system, to systematically then set up systems for giving out cash, but also just not cash. A cash plus approach needs to be better institutionalized, a strengthening of the civil registration system so that we can identify vulnerability quicker, and we can also kind of predict a deterioration of vulnerability better. There is also an emphasis on impact evaluations. As we saw earlier, not all programs had been evaluated, and obviously scaling up some of the programs which seem to have some good systems in place already, whether it is child grant program or programs like the AMA program and the scholarship program. But the overall recommendation that we see is for the government to become a bit more receptive to use of cash and to the expansion of the child grant program. And I'll talk a bit about both cash, because the supply is in a much better shape now. The essentials are really moving across. The essential shops are open. The lockdown is not that severe. And the needs of populations are obviously beyond the food, because they have health needs, clothes, and any medicine, and all kind of other hygiene products, and which have actually been emphasized in the child and family tracker that we have implementing, that the needs range from food to non-food. So that's the reason why we should be doing cash. Cash obviously is more efficient in terms of it's cheaper to get out. The third reason, in terms of expanding the child grant program, in an assessment which was done, or a kind of a quick assessment which was done by Development Pathways, and we were also kind of privy to that, if government was to able to expand the child grant program, they would be actually reaching 90% of the populations. So these would be our key policy recommendations. And I think that's it. I look forward to getting your questions and answering them, and further interaction. Thank you. Over to you, Nenke.
Thank you very much, Usha, for summarizing the key findings of these studies done in Nepal, but also sharing with us your own reflections, specifically on the COVID response and the challenges Nepal is facing in expansion of existing programs and responding to COVID-19 through social protection systems. We won't take any questions for you now, but I see the first questions in the Q&A box are coming in. Thank you very much. We will respond to those afterwards. I will now hand over to Isabella for her presentation on Sri Lanka. Please go ahead, Isabella.
Okay, so good morning, everyone. Thanks for coming. I will now present the main takeaways for Sri Lanka from the 6 comparative studies. So starting with, okay. So Marina, can you pass the slide, please? Or Karini, it's not working here. Yes, thank you. So starting with the legal framework of Sri Lanka. So Sri Lanka is signatory of all 9 core human rights instruments related to social protection, children rights, okay. And an important step was in 2018, when the Committee on the Rights of Children has called for further efforts to transpose one of these conventions, which is the Convention on the Rights of the Child, in a customary legislation. And it was indeed done, it's still in 2018, and now the legislation related to children's rights is more integrated. Now, can you pass, please? Okay. Now, keeping with legal framework, you can see here in this slide that just 2 of Nepal's program has its own regulatory framework, that is Samudi, also called Jiveneguma, and the Public Welfare Assistance Allowance. Okay, the Constitution enshrines a right to social protection, but as a policy principle only, and not as an enforceable right. But an important step was in 2002, when the Welfare Benefits Act was launched, and it regulates aspects of implementation and administration of programs, social protection programs in Sri Lanka overall. Next. Okay. Now here we can see the level of compliance of the 2 programs which have their own regulatory framework, the level of compliance to the human rights-based approach to social protection. We can see that for just one of the criteria, that is define the various roles and responsibilities of all involved, Both programs got the highest score, which is 4. So there is still room to improve the compliance for the other criteria. Next. Okay. Here now I will talk about social expenditure in health, education, social system by country. We can see that Sri Lanka is kind of the average in South Asia. But however, as an upper middle income country, Sri Lanka could consider expanding its fiscal space, partly because also they have low personal and corporate taxation revenue. And this would be a way also to address the inequality in this country. But on the other hand, it's also commendable that Sri Lanka is able to deliver good results and good in care and health and education social systems, even though they spend less. So it suggests a good administrative capacity. Next. Now here in this table, you can see a snapshot of how we systematized all the information of the non-contributory flagship national programs. That was the focus of the overview study. And here we can note some trends. First, you can see that Sri Lanka has universal cash transfers programs combined with other kind of programs in a same initiative, and that they combine poverty targeting with categorical targeting towards different vulnerable groups. And as each program tends to target different vulnerable groups, the system is kind of balanced among those groups. We can see here children, elderly, orphans, women, and so on. Next. Here in this graph, you can see the program shows the total coverage of Sri Lanka's initiatives. So the program with the greatest share is the Divine Guma program, also called Samudhi, then the school feeding one, and then the triple share. Even before the crisis, it's good to note that the coverage of the social protection system in the country was up to 27% of the population. But here in this number, excluding the school feeding program to avoid overlaps. Next. Here now in this graph, we analyze child and gender sensitiveness. We can see that Sri Lanka does not have a program that targets specifically women in general or children in general, but nonetheless, the programs have some child-sensitive features, and yes, the program support the children's rights, like access to education, health and nutrition. And also there is Triposha that targets pregnant and lactating mothers, and also the children by delivering food supplements to them. So it's a nutrition program. So next. Here we can see the impact evaluation findings. This table is also a snapshot of how we systematize that data in order to make an analysis. So despite Sri Lanka having a very well-established social protection system, some of the oldest programs have more than 2 or 3 decades. There is not a comprehensive evaluation study. The only 2 ones that we got studies was Samudhi and Triposha, and the indicators evaluated were related to health only. So there is this opportunity that was missed, and Sri Lanka could consider investing more in impact evaluation. Next. Talking about now a bit the social protection response. So Sri Lanka based the response in adapting the existing programs. mainly by horizontal expansion, but in some case, vertical expansion as well. And for Tripoltia, there is a delivery adaptation. Before, the recipients had to collect the food supplement in health facilities, and now this is delivered at their homes. The response was vigorous and was quick. But as Sri Lanka now lacks an integrated information system, the answer could be even better if they invested on this. Would be quicker and would be less costly as well. But on the other hand, it's now an opportunity to Sri Lanka to include these new people that are being covered through horizontal expansion and to make this integrated comprehensive information system. Next. So now I'll talk about the policy recommendations. The first one is to increase fiscal space. As we discussed before, as there is a low personal and corporate taxation in Sri Lanka, then to roll out cross-cutting statutory legislation to coordinate child rights. The act that I mentioned before from 2018, yes, was a step towards it, but there is still some related rights, child rights, that is not in this new act. And 3, to roll out regulatory frameworks, specific regulatory frameworks to the programs that are lacking it. And for the 2 ones, there is PAMA and SAMUJI that already have the compliance to the human rights-based approach to social protection could be improved. Then, as we discussed, number 4, subject existing programs to impact evaluations. And it's also interesting to know that if Sri Lanka invested in a better integrated information system, the cost to do periodic monitoring, exercise and evaluation studies would be cheaper. And it's also a way to correct possible mistakes and identify best practice. So next. So policy recommendations, slide number 2. Policy recommendation number 5, increase bancarization. It's thought that most of the programs deliver cash. And this would be a way to lower administrative costs and also improve the shock responsiveness of the system. And number 6, as we discussed before, take advantage of the horizontal expansion that is happening right now to already include these new beneficiaries into an adequate information system. And 7, convert the funds as for COVID emergency programs into funds for lasting social protection programs, because the pandemics and the virus can be over soon, we hope so. But unfortunately, the socioeconomic consequences will be that to be addressed. Then number 8, Sri Lanka could consider adjusting the cash benefit values in order to make the most of it and to potentialize the desirable socioeconomic impacts to the beneficiaries. Number 9, to reduce exclusion errors through the current poverty targeting methodology. So Sri Lanka could review it to try to lower these exclusion errors. Or even better, as suggested in number 10, would be an option to cover this gap by launching a universal child grant, and this way our children in Sri Lanka would be covered by it and supported by the social protection system of the country. Next. So that was it, my presentation. Thank you very much. In case of any questions or comments, you can feel free to write me my email address. And over to you, Ning.
Thank you, Isabella, for this great presentation on the legal framework. That is very helpful for us to understand, and also the overview of the social protection landscape in Sri Lanka. And we will now turn to Louise Louise, who will complement this presentation on Sri Lanka with insights on the ways ahead and also new goals to be pursued by the social protection sector in Sri Lanka. Louise, over to you. Louise, you're still on mute.
Sorry.
Yes,
hi, everyone. Hi, thank you. Thanks for joining us, everyone. Thanks, Isabella, for the presentation on Sri Lanka. We learned a lot about the legal framework and what exists in Sri Lanka. And I wanted just to complement a bit with a bit more detail on the response here to COVID. So UNICEF here has been working with the government of Sri Lanka and from the beginning trying to provide sound policy advice and bringing evidence on the impact that COVID is having on households, but also on the impact or the coverage of the emergency cash transfer response that was put together by the government of Sri Lanka. So it's important to highlight that even before COVID hit, prior to the crisis, we already had a situation in which while the poverty prevalence, the poverty headcount in Sri Lanka is quite low, only 4% of the population lives below the official poverty line. Nevertheless, we had a majority of the population living on insecure incomes. So 75% of the population was living on less than 600 rupees per day, which is about $10 PPP. Therefore, we're already vulnerable to shocks, and particularly a shock like COVID. And so with COVID, families are even more vulnerable. We had very rigorous, very stringent curfew here in Sri Lanka, where everything was closed, including grocery stores and pharmacies for the first few weeks. So it was one of the most rigorous lockdowns or curfews in the world. I also have to say that Sri Lanka has been quite successful in containing the spread of the virus. We have less than 3,000 cases in total. We have had only 11 deaths, and that's thanks to the strong response of the government of Sri Lanka. But nevertheless, all of these measures that have been put in place, of course, have an impact on people's ability to earn incomes. And in a situation where you already have some level of vulnerability. So here we did both estimates of the impact of COVID crisis in the Sri Lankan economy and therefore on household incomes. And separately, we did telephone surveys, nationally representative telephone surveys with over 2,000 households to understand the impacts. And the telephone survey corroborated some of the estimates that we had done using the household income and expenditure survey data. And where we saw in the first month that we did in early May, referring to April, where we were in a situation where we were already in curfew, strict curfew. 39% of the respondents said that they had lost all of their incomes, and 32% said that they lost some income. We don't know how exactly, but how much exactly. But so what we see is that there was a high percentage of the population that was negatively affected, and that was across the board, not just the bottom quintile or decile, not just the poorest layers of society, but as is happening around the world, families from across the welfare distribution are suffering from COVID. So we had estimated that the households were going to have a reduction of income of up to almost a third, 27–30% of their incomes. The government of Sri Lanka was very quick to respond, and they are to be congratulated. We went into curfew on March 20th, around March 20th, and 10 days later, the government already announced an emergency cash transfer response, with advice that UNICEF and other partners provided on utilizing the existing social protection system, although imperfect and not integrated without a strong MIS, but utilizing those programs to reach families with cash. And they put in place a very large and very quick approach where they supported families with 5,000 rupees. So little, around $30, with less than $30 for April and May. So for 2 months. And they did that by expanding horizontally and vertical their existing programs. So they provided 5.7 million cash transfers in those 2 months, and as I said, very quickly, and actually going to people's home and delivering the cash transfer in hand, because everybody was stuck at home. They were not supposed even to go to a bank. So very remarkable expansion. So they utilized, here's just to show some of the programs that were utilized, the existing social assistance programs, Samurdhi, that was mentioned by Isabella, Senior Citizen Allowance, Disability Allowance. They were utilized, they were expanded vertically and horizontally. Everybody who was on the waiting list was included, and the amount was increased for most of the programs. And also they included new beneficiaries that were not in any of these programs, like these self-employed workers. They reached more than 2 million workers, self-employed workers, that were not already in these existing programs. The existing programs have very high exclusion errors. So now we have, as Usha mentioned in her presentation as well, a benefit that we have now a list, the government, of additional vulnerable populations that could be potentially integrated into this in a more permanent basis. So it's quite impressive what the government of Sri Lanka has done. They spent about 0.33% of GDP in this 2-month response. But then it stopped there, unfortunately. And what UNICEF did from the outset, when it was announced, we estimated who would benefit from the government intervention. And what we see as it moved, we also updated our analysis. And what we estimate is that 69% of the population and 66% of households would receive or have received this support, which is a pretty high coverage. And the coverage among the lowest deciles was quite high. Nevertheless, there is still a significant proportion of the poorest that were missing out from the support. Among the third poorest decile, 20% of households were excluded. There was also high exclusion, a third of all children, a third of elderly over 70, and about half of the households that are single-headed, mostly single female-headed household, were excluded from this response. So, and that it wasn't by design, but simply because government was utilizing programs that had such high exclusion errors to begin with. So the current design of Sri Lanka social protection system resembles what we see in many countries that we can call a poor relief system, where you have a minority of the population who is in the formal sector and who is particularly those who are civil servants who receive a pension or provident funds. And then you have a part of the population that receive social assistance, those deemed the poor, as if that was not dynamic, changing all the time. Nevertheless, you have a lot of those in the middle that are excluded from social protection, that neither receive assistance nor receive social insurance and unemployment benefit and so forth. And this is not just a reality in Sri Lanka, it's a reality in many countries. So many live in these insecure incomes. a class called the Precariat by Guy Standing and others. So for many countries, there is a real risk that as this missing middle keeps getting left out, that will cause instability in countries. So what we propose here as UN, as UNICEF and UN, in an advisory paper to the government, we proposed as a response to COVID, as a second stage of response to COVID, to provide emergency life cycle transfers in Sri Lanka. So to universal child benefits for all children 0 to 17, universal disability benefits, and universal old age pension to those 65 years old and plus. We propose these specific transfer values that they go between $16 to $38. And we costed these options. And beyond that, so we came to a cost of about 1.5% of GDP, which many would consider even low to stimulate the economy. But we were trying to come up with something that would be the cost for 6 months, providing these universal life cycle cash transfer for 6 months, not just as a way to protect lives and protect livelihoods, but as an economy boost, because of course people will consume, and so that money goes back into the economy, to build trust in the government, because you are utilizing very transparent criteria for reaching people, right? Not self-employed, oh, how do you prove you're self-employed and that you're a tuk-tuk driver or this, but rather categorical by age, ability, status. So much more transparent, enhance the well-being, boost consumption. So many positive externalities and impacts of this. And we did economic modeling, CG modeling, to see the impact on the economy if this 6 months of at 1.5% of GDP were done, and if they were to and also if they were to continue, if the government were to continue to invest 1.5% of GDP in life cycle transfers. And by doing that, it would result in the economy recovering to where it would have been without the COVID-19 crisis already by 2021. And that by 2030, the economy would be actually larger than if no further fiscal stimulus is implemented. So what we see here is that it's an investment that has a very real return, not only at the individual level, but the aggregate economic level. And we proposed this, we presented this to the Prime Minister. Sri Lanka right now is going through a very difficult financial situation with the debt, and then we had elections, so the cash transfer had to be stopped. And now we had elections just 2 weeks ago, and now we're going to again be discussing how Sri Lanka can improve its social protection system, perhaps move towards universal approaches, and allow it to be able to respond to shocks in the future a lot more efficiently and effectively. So we see this as helping to move the universal social protection agenda, providing major economic stimulus to countries around the world, protecting the human rights, ensuring food security of families, because we also saw here in our telephone surveys that at least 1/3 of families say they have reduced their food consumption. So there are also issues, concerns in that front. And of course, we know that social protection, that universal life cycle transfers were a key component of Europe's economic and social success after World War II, when they were poorer than Sri Lanka is at present. So we believe it's an investment that can be made. Of course, we need a lot of political will, of course, as well as the technical fiscal space decisions on that. So I just wanted to present this to you, and happy to answer questions later on. Thank you.
Great, thank you very much, Louise, for this very interesting insight on the possibilities for social protection in Sri Lanka, and how Sri Lanka can include that missing middle you were talking about. Looking at the time, we need to quickly move on to Afghanistan. Let's see. change the slide. Beatrice, over to you.
Hello, everyone. Well, as Nika just said, my name is Beatriz, and I'll be presenting the findings of the comparative studies for the context of Afghanistan. Now, I'm having some troubles moving my slides. Oh, yes, great. Now, there it is. Right, so before I start, I actually have a few disclaimers to make about this presentation in particular. Afghanistan is a bit different from the other countries in South Asia because of the current stage of state building that it finds itself in. So its institutional framework is currently changing very fast, faster than the other countries in the region. So for this reason, I will be, for this presentation, only complementing the findings from the comparative studies with the findings from the IPC's bilateral agenda with the UNICEF Afghanistan. So for this presentation only, we will not be talking about two programs, the ones marked in red that were identified in the comparative studies. I will be mentioning the National Rural Access Program that is marked in yellow or mustard. And we also decided to add the Women's Economic Empowerment Rural Development Project from the bilateral agenda. Further, I also have a small disclaimer regarding data revisions and updates. Again, because Afghanistan is quite different from the other countries in the region, we decided to complement the findings from the comparative study with national data, because the comparative studies, in order to make these comparisons, they use comparative databases from, well, compiled by the World Bank based on the WHO, the World Bank's Aspire database, and UNESCO. And there's always some small differences in comparative data when you look at national data. However, in Afghanistan's case, the difference is actually quite large because Afghanistan has a very significant off-budget expenditure on social protection, education, and health. And the comparative databases only compile on-budget expenditure. Right, having said that, so the findings from the legal study show that Afghanistan has ratified 7 out of the 9 core human rights instruments. The only 2 instruments that were not signed by Afghanistan were the International Convention on the Protection of the Rights of All Migrant Workers and Their Families, and the International Convention for the Protection of All Persons from Enforced Disappearance. A very commendable and positive result that was identified during the legal study is that in 2011, the Children's Rights Committee criticized Afghanistan for its legislation on children's rights. And then as a response in 2019, the Children's Rights Protection Law was actually enacted. Then looking at Afghanistan's constitution, it does not explicitly grant the right to social protection as a constitutional right. However, it does put forward some related rights to social protection. Further looking at statutory legislation, Afghanistan has a social protection law that was enacted in 2018. However, this social protection law differs from other types of social protection laws in other countries because, again, coming back to Afghanistan's current process of state building, this law dictates more aspects of the governance of the social protection system rather than more operational features of social protection. Further, because Afghanistan is in this stage of state building and rapid institutional changes, for this presentation, even though it's not within the scope of the legal study, we decided to also mention the sub-statutory guiding documents for social protection, namely the National Peace and Development Framework, the National Priority Programs, and the Afghanistan Development Goals, which play quite an important role in the country. Then out of all 4 flagship programs that are going to be mentioned in this study, the Martyrs and Disabled Pension Program is the only program that is based on statutory legislation, therefore it's the only flagship program with a regulatory framework. This framework was analyzed to see how it complies with the human rights-based approach to social protection. And unfortunately, its regulatory framework does not guarantee or does not mention participatory channels, and it does not articulate long-term financial requirements. Now if I can change slide, great. Now going to the social expenditure, keeping in mind the disclaimers that I mentioned in the beginning. So the graph to the right that you can see is based on the on-budget expenditure from the comparative databases. And the results I'm about to explain to you are based on both the on-budget and off-budget expenditure data. So here it's important to keep in mind that about 60% of public spending in Afghanistan between 2005 and 2009 was actually funded by international aid, so it's off budget. And about a third of international aid didn't even go through the state, which also explains why, for example, the Aspire database doesn't really include the spending on social protection for Afghanistan. Now, considering off and on-budget expenditure, we can see that there's about a 400% structural gap between government revenue and expenditure. And then looking at health spending more specifically, well, we can see that adding the off-budget expenditure kind of doubles what the WHO reports. But nonetheless, despite this high health expenditure, about 77% of health expenditure is still out-of-pocket payments. And although the coverage of the healthcare system in Afghanistan is currently increasing, there's still worrying findings such as that there's only a 65% immunization rate in the country. Further education spending is a lot of the education spending is actually already on budget, which is a positive finding. So it goes through the state. However, and about 3.9% of the GDP spent on education, which according to the UNESCO falls within the good range. However, about 50% of children are still out of school. Right, now going over to the next study. Then this presentation will be talking about, in more detail, more about 3 of the flagship programs identified. Because the National Rural Access Program, although depending on how broadly defined social protection can be seen as a social protection program, for our more narrow understanding of social protection in this presentation, it will more be understood as a development program. Now, looking at the flagship programs in Afghanistan, the backbone of the flagship programs consist of Cash for Work, unconditional cash transfers, sustainable livelihood programs, and training. What is important for Afghanistan and also makes it stand out is that also related to this process of institutional capacity building and change institutional framework is that some of the social protection programs are not purely social protection programs. They can also be seen as programs for institutional capacity building and wider development programs. I will come back to that later. Then the core targeted groups include internally displaced persons, the working age population, elders, and the disabled. And the main selection processes identified are mainly geographical and categorical targeting. Now, the 3 main flagship programs include the Mortars and Disabled Pension Program, which is the sole one that can mainly be understood as a conventional non-contributory social assistance program, although it does bear some similarities with social insurance due to how it's linked to your ability to work. It is a bit of a regressive program because the benefit amount is linked to your salary, and the formula benefits even more people who used to work as civil servants and the military. And in general, it awards benefits to people who acquired a disability, especially due to conflict, and people born with a disability, as well as their descendants. Now, the Citizens Charter is one of these programs that is not only a social protection program. In fact, the Citizens Charter can more be understood as an institution, as a framework. However, it has a component that led us to include this as a flagship program. And this component entails mainly cash for work and also social assistance to those who cannot engage in cash for work. Then the Women's Economic Empowerment Rural Development Program is similar to the Citizens Charter in that it can also be understood as a framework. However, just like the Citizens Charter, it has a component that provides training and catalytic grants to rural women, and that's why we are seeing it as a flagship social protection program as well. Note that the mapping of flagship programs only looked at non-contributory state-led programs. Now, looking at how child and gender sensitive these programs are, there's a concerning absence of programs explicitly dedicated to children, pregnant, and lactating women. However, there is some child and gender sensitiveness to report. So first of all, of course, the Women's Economic Empowerment Rural Development Program, it explicitly targets women. It prioritizes poor rural women and women from insecure districts where returnees are present. And then the Citizens Charter and MDPP have components that indirectly benefit children and women. So the Citizens Charter, for example, provide food grain banks, and this has indirect benefits to child nutrition, and also a social inclusion grant to those households that cannot work in cash for work programs, tends to benefit women and single women through, for example, female-headed households. And then the Martyrs and Disabled Pensions Program, because it awards benefits to heirs of foreign beneficiaries or martyrs, it indirectly benefits children and female widows. Now, the impact evaluation study found that, unfortunately, none of the flagship programs as we currently know them have undergone an impact evaluation. However, the predecessor of the Citizens Charter, the National Solidarity Program, underwent a very commendable and very comprehensive impact evaluation with a baseline year, 2 of the main comprehensive evaluations, and 2 more focused evaluations on children's health and female health. Now, note here that dark green implies a statistically significant desirable impact, whereas dark orange is statistically significant undesirable impact. Although note that this undesirable impact on qualified birth assistance did later fade away. And the delay that we can see in the desirable impacts on income and education are probably related to the fact that there was a shift in the priorities of these programs from more individual welfare to a more community welfare program. Now, about the social protection responses to COVID-19 in Afghanistan. So the 2 flagship programs were actually adapted for the COVID-19 response. The Martyrs and Disabled Pension Program was horizontally expanded to also cover the descendants of deceased health professionals, provided they worked in the public sector. Keep in mind, though, that this was, to my latest understanding, this is just an announcement. And then the World Bank is currently planning to repurpose $100 million for relief efforts under the Citizens Charter. That plans to cover around 90% of Citizens Charter beneficiaries through cash and in-kind transfers. Further, there's a lot of actors in Afghanistan, humanitarian actors, development partners, and this large group of actors have cooperated, including with the government, to provide a variety of emergency in-kind and cash transfers. Most notably, the World Bank recently announced the REACH program to provide in-kind and maybe also cash transfers. Then there's a national plan for distribution of baked bread and also distribution of wheat led by the government, although these 2 programs have been criticized by national media for the adequacy of these food transfers. And then there's a variety of humanitarian cash transfers in which the humanitarian sector is very much involved. And here for the COVID-19 response, it's important to keep in mind that Afghanistan already had a relatively low coverage of social protection before COVID-19, where even the poor population, which is quite large, is about half of the population before the pandemic. So a large chunk of that population was already not covered. So in addition to the challenge that other countries in the region face of covering the missing middle, Afghanistan also has the additional challenge of covering the poor. Finally, based on all of this, we have the policy recommendations. So first of all, to expand coverage of the social protection system, ensuring that it covers and provides social protection floors. Then to, when covering these gaps, the second recommendation is to prioritize rolling out new initiatives targeted at children, pregnant women, and lactating women, who are currently not targeted by flagship programs. Then it's also important to launch streamlined, more conventional social protection programs, because as I previously mentioned, a lot of programs are kind of a mix of institutional capacity building, development programs. So it would be good to have a more conventional, streamlined program for social protection. Then it's important to support and consolidate the coordination within the social protection sector, as there are quite a lot of actors, governmental, non-governmental actors. Then we would like to jointly elaborate a social protection policy and use it as an opportunity to, well, of course, it would be guided by the social protection law, but it would also be interesting to amend and complement the law as it does not have these operational features. Then the sixth recommendation is that the MDPP should be made more progressive, and also to amend its legal framework accordingly, and also to make it comply more with a human rights-based approach to social protection. Further, we recommend that governments and donors should further their efforts to have external funding processed on budget, especially in health and social assistance. It's also important to improve administrative registries and develop an integrated information system. And more linked to COVID-19, we also recommend the social protection sector urgently implements social protection initiatives to complement the humanitarian response. And linked to the previous point, it would be interesting to use the emergency response to COVID-19 to collect basic information on beneficiaries, keeping in mind the need later for administrative registries. So I hope this presentation was informative. If you have any questions, feel free to ask in the Q&A or send me an email. Thank you.
Thank you very much, Beatrice. We will now start with the Q&A session. We've had some questions come in, but please do continue asking them, and we'll get all of the panelists come back with their camera on, available to answer your questions. We will start with a question for Usha, and I have one for Louise here. Usha, one of the participants is asking that one of the frequent concerns with putting social protection in the hands of subnational actors is possible heterogeneity in the quality and amount of services being delivered across the country. Has this been a concern in Nepal, especially during COVID? That's a question for you, and then I'll continue with a question for Louise. The cash assistance provided in Sri Lanka, was it the same for all income brackets, or was there a reason why it wasn't based on need and income levels? So we'll start with those two, and then we'll get more questions coming. Usha, over to you. You're still on mute.
Okay, sorry, I'd forgotten to unmute my camera. So thank you, Yannick, for the question. The decentralization or federalization, in fact, as it is called in Nepal, is a very interesting juncture, right? So and also it's a very unique kind of federalization where there is a direct relationship between the center, Kathmandu, and the subnationals, which is what is called Palika. And in many ways, the states and the provinces have been bypassed. So you probably would not see that kind of federalization in many countries. Now, there are pluses and minuses. Obviously, that's a whole discussion in itself. But let me go back to your question. So in terms of where the experience is, it's still settling down, right? Basically, 18, 19 were pretty much the period of teething period, assessments were being done just to understand what's happening, where the capacity gaps are. And COVID kind of has set that process back number of months and maybe a couple of years. As far as the social protection is concerned, it still remains pretty centralized. The financial allocation remains pretty centralized. Now that's a good thing, right? Because that would ensure that the concerns around the poorer states not having as much of money to fund the social protection programs would be taken care of, because the finances are equitably, or at least they are linked to the number of beneficiaries, are being given out by Kathmandu. So that's one of the pluses. Now, in terms of the challenges, the implementation, and here the bulk of implementation is the registration. the registration has been decentralized. And that's exactly where we see the challenge. So some states are performing better than the others. And even within the state, some districts are performing better than the others. So you'll see a province, a district, and the municipality effect in terms of how robustly exclusion is being addressed, how timely some of these payments are. So UNICEF definitely is concerned. And so what have we done? We have looked at which of the provinces are kind of laggards. So for example, we are focusing in partnership with EU and DFID on 2 provinces, Province 6 and Province 2, where some of these indicators of implementation of social protection programs are worse than the others, and also the human development indicators are worse, so that we can improve social protection just in general. That's the brief answer to your question. So to summarize, absolutely right, but the finances are still centralized. The new social protection programs that provinces are thinking of are from their own pockets, so to say. It's their provincial money. And last point is that, yes, we're absolutely cognizant of that. And we have designed some province-specific support, capacity building, and institutional development kind of programs. So that's my response.
Great, thank you, Usha. That's a great response. If there's any follow-up question, do feel free to put it in the Q&A box again. Then over to Louise for the question on the transfer values and whether it was the same for all income brackets and whether there was any differentiation based on need or income levels.
Yeah, no, thank you. Thank you for a very interesting question. The value was the same across the board. And I think partially because it was a very quick response. And the rationale for the amount is not entirely clear. I have a feeling that it was a practical decision, because 5,000 rupees, there is a bill of 5,000 rupees. And this money, this cash transfer, were being distributed to recipients in their homes, in their communities. So you imagine, somebody coming with bags with money being delivered. Even though normally the Samurdhi, for example, which is the biggest cash transfer program in Sri Lanka, the cash transfers are normally received via the Samurdhi banks that are across the island. But this time they were included, they were given in person. So it was one across the board to everyone from the same programs. The only difference is that some recipients, for example, people in the disability allowance recipients, they already receive normally 5,000 per month. So for them, it was no difference other than increasing horizontally to the waiting list. But for example, for the senior citizens allowance, which is only 2,000 rupees per month, they received a top up of 3,000, meaning that they received also the maximum of 5,000. So we're hoping that the government of Sri Lanka will be able to document what they have done beyond what we have put together, as also a case study, and also find the lessons learned. But no differentiation between, I think there was an assumption that everybody in the programs, even though it's known that there are inclusion areas and exclusion areas, everybody in the programs were in the vulnerable category, and plus the new ones that were included, that were in theory assessed by a committee in the community level, whether they were really vulnerable. So there was this assumption that everyone was vulnerable, the amount was the same. Over.
Great, thank you, Louise. 2 more questions. We'll stay with you for one of them, Louise, and then we'll go to Beatrice as well. Louise, on the UNICEF proposal you described in your presentation for 1.51% of GDP to cover 20% of pre-COVID household consumption, there's a question on whether there's an estimate on how big the loss, average and bottom of the income has been as a result of COVID-19. So in other words, how much extra poverty caused by COVID-19 would the proposal that UNICEF has prepared offset? And then Beatrice, for you, a question on programs linked to children in Afghanistan, like child benefit or nutrition linked mother-child cash transfers. And would there be a need and appetite for this? And also a question on the geographical spread of the programs you included in your presentation. Louise, let's start with you and then we'll go over to Beatrice.
Thank you. No, another very, very good question, and I'm taking notes. We have a longer study and then a summary of the study, and I can share with our participants. We're in the middle of making a few changes to the, I can share the link now, but we're in the middle of re-uploading an updated version. But in that study, we estimated the impacts of the proposed emergency life cycle, and they are significant. And we estimated the impact across households in the different incomes. And we look, for example, across the welfare distribution. For example, those in the bottom 3 deciles would on average be in a better position than before the crisis. So it's a very pro-poor, it would be a very pro-poor approach. So, you know, if lots of people would on the bottom would actually be better off than before COVID. And we also looked at, you know, by age, even if they were not better off, the impact on the income, the income loss, it would be significant as well, making it not as big. So that is also, we estimated that, and that's in our paper that I can share with you. I have here in front of me. It's very rich with a lot of information, but I was trying to keep it short today, but I will definitely share the link with the caveat that is being updated. Over.
Great, thank you, Louise. Over to Beatrice for a short response.
Hello. So first of all, about the geographical coverage of the flagship programs that I mentioned. So the Citizens Charter, from the last information that we gathered, currently covers about 1/3 of the districts in each province in rural areas of the country and 4 major urban hubs besides Kabul. This is, again, the latest information that we have. Then the Martyrs and Disabled Pension Program is meant to be a program with national coverage. And the Women's Economic Empowerment Program, let me just quickly double check here. So again, this is based on the most recent information, but based on what we know, in its current phase, it covers about 76 districts in the 34 Afghan provinces. Yes, no, I just, right. And then in terms of cash transfers targeting children. So, well, currently the flagship programs, they do not specifically target children, which is a major gap that we identified, especially given Afghanistan's very young population. Looking at the COVID-19 response, I would highlight that the part of the humanitarian cash transfers that I came across, they do provide cash transfers to children specifically, or at least change the cash transfer amount if there are children in the household. Then Ninke can maybe compliment me on that in case she has more information on this. And in terms of interest for a cash transfer targeting children and lactating women, I suppose your question is kind of predicting the future here, because during our bilateral agenda between the IPC and UNICEF Afghanistan, we are already considering the possibilities of a cash transfer focusing on children. That's also a recommendation that we emphasize. But currently, if you look at the state-led initiatives, this is a major gap that we need to point out. Thank you.
Yes, thank you very much, Beatrice. I won't add to this now because we have a lot of questions for the panelists to come as well, and we only have 5 minutes left. So I'll go back to 2 questions on Nepal. There is one on the balance and interaction between development partners and the government of Nepal in delivering social protection as part of the COVID-19 response. That's one for you, Usha. And another one is on whether UNICEF is collecting any disaggregated data on social diversity and whether there is any disparity between groups in terms of access and support. And if you can please keep it brief so we can stick within the time. Thank you, Usha.
Right, thanks so much. So in terms of the division of the response, um, you know, because the government has not been very supportive of cash, many NGOs or many international NGOs who wanted to do cash, they didn't get the go ahead. That was one reason, but also the amount of cash that some of the international NGOs wanted to do was supposed to be linked to the minimum expenditure basket, which is almost twice or thrice the amount that the government was giving. And then there was a reluctance about that as well. Having said that, there's some NGOs who have gone ahead, like Plan was able to do a more modest social protection relief. But overall, the predominant response has come from the government, but there's still an area of discussion. And I hope that, you know, there would be spaces opening up for more international players to come in. And especially as we have seen, the economic impact kind of intensifies. Second question was it about integration? Can I just clarify that?
Well, you can take that one too. There was one on integration. What are the challenges with integrating these programs? And then there was a question on the disaggregation of data,
Right.
whether UNICEF is collecting any of that on social diversity.
Sure. So on disaggregation of data, absolutely. And so this is being disaggregated along the geography, which is rural, urban, along all the provinces, as I mentioned, but also along ethnicity. And we are here, for example, looking at Dalits, which is so-called the most marginalized caste. We're looking at other castes like Hills and Brahmins, and we're also sometimes bringing geography with caste. So, for example, there's a category called Hill Brahmin or Hill Kshatriya. Maybe these terms are kind of alien to you, but we are, and then obviously there is quintile disaggregation. There is also disaggregation related to disability and sex and so on and so forth. So it has been sliced along a number of dimensions, and some very interesting insights are coming out of that study. Let me go to the integration question. It's a fantastic question. And I think just not for Nepal, but for many countries where there are multiple programs and countries which have gone ahead with implementing programs. And obviously they, on one hand, they have been able to ensure that there is something to capture and address vulnerability. And so programs have kind of, you know, also multiplied, and there obviously has been a populist drive to it as well. So any new government comes in, kind of announces a new program. And this problem you'll find more in other countries than in Nepal. The good thing about Nepal is that the portfolio has been pretty steady. So for example, these 5 or the big cash transfer programs for the old age people, disability, single women, children under 5, children of Dalit families, they have been there for some time, and not a new cash transfer program has been added. Cash for work has been there. So it has been a very steady portfolio. But if you look at what exactly Nepal has, then just by a count that NPC conducted for its draft social protection strategy, there are more than 70 so-called social protection programs. So why they have not been able to integrate? There are different reasons. And the starting point I would emphasize is the lack of an overarching strategy. So Nepal went ahead, as do many other countries, went ahead, designed, implemented its programs without an overarching ambition. So, and then that meant that there was not a single institution which was responsible for coordination, avoidance of duplication, enhancing cross-program synergies, etc. But Nepal government is addressing that. As I said, we, UNICEF, DFID, and a few other partners of EU and a few other partners are working with National Planning Commission. A draft strategy is ready. We hope that this will be finalized by the end of September, and NPC has been mandated to support this coordination and integration. So having a strategy would be the first point. But after that, there are many more challenges. How do you take powers and resources away from an existing program? How do you fold up an existing program? Because a program erects its own vested interest. There's along the whole supply chain and the delivery chain, there are a lot of people who have their stakes. So, you know, these all become completely contentious issues within political economy sphere. So you need a strong leadership, and we are hoping that National Planning Commission, since it's a coordinating central agency, might be able to provide that, but we still need other stronger partners like Ministry of Home, which is responsible for the portfolio of the cash-based social protection programs, and last but not the least, Ministry of Finance. So an overall leadership but obviously a collaboration with some of these important, powerful ministries is probably something which will make it easier for Nepal to further the integration agenda.
Thank you so much, Usha. Unfortunately, we are out of time. So if your question has not been answered today, the team at socialprotection.org will take your questions and publish them later on. Thank you so much to Usha, Isabella, Louise, and Beatrice for your very interesting presentations today. We've seen a lot of different presentations on different social protection landscapes that we have in the region and a very different response to COVID-19. Well, in some countries, we could actually build on existing programs and include the missing middle, and others, countries like Afghanistan, was suffering with even including those extreme poor and didn't have those existing systems to build on. Obviously, in the rest of the webinar series, we'll continue to look at other countries in the region, so please do sign up to those. Links will be in the chat box if you've missed them. And also don't forget, there is a post-webinar survey where you can share your feedback and thoughts that the social protection team has just posted in the chat box. That's all. I want to thank all the speakers for your time and all the attendees as well for joining us this evening or this morning or afternoon, wherever you are. And I wish you all a very good day. Thank you very much. Bye-bye.